If I was stranded on a deserted island and can only take one laser with me, which one would I bring? Which one would have the biggest impact on overall skin health and to give my patients and myself the most beautiful, healthy, flawless skin without the need for makeup over a lifetime? Beautiful skin at every age. What laser would I take with me? Which laser is able to achieve this? Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, double fellowship-trained cosmetic dermatologist in Newport Beach, California. And I provide these YouTube videos for you to be a source of true and honest information in a world that's contaminated with clickbait education, misinformation, and fake science. These videos are unbiased, science-based, and non-sponsored because I want to be a safe haven and a source for true and honest information so that you guys can make better informed decisions for yourself to have the best skin of your life and have beautiful skin at every age. As always, my content is non-sponsored, so I don't work for any company and I'm not in any paid partnerships or affiliation with any company or any laser or any product for that matter. But I love the freedom to be able to recommend what I truly feel is best for my patients, and Fraxel laser resurfacing is one of my favorite treatments in the office for patients of all ages. Whether you're using it to reverse sun damage, to minimize your skin cancer risk or the risk of precancerous lesions, or you're doing Fraxel to reverse acne scars or for anti-aging benefits to smooth out fine lines and wrinkles, Fraxel laser resurfacing using the Fraxel Dual, also known as Fraxel Restore, is one of my favorite treatments. And after watching this video, you'll understand a little bit more of why I love this device and how it can change your skin to have the best skin of your life and the healthiest skin of your life. Now, fractionated resurfacing, just to kind of give a little laser lecture, just how I do the derm residents when I teach them and the medical students, fractionated lasers are just lasers that treat a fraction of the skin. So you can change the settings to target a certain percentage of the skin. So when you're talking about lasers affecting the skin, you talk about a spot size. And within that parameter of the laser beam, you can have different percentages of the skin treated. So you could treat 5%, 10%, 20%, 50%, and that just has to do with the density of the skin that's treated in a ratio of skin that's not treated. So instead of having a fully ablative laser, which is going to treat the whole surface area within that spot size of a laser, you can have it be fractionated, where it's just treating a fraction of the skin. And that usually correlates with a faster recovery, less downtime, and pretty equivocal results to a fully ablative laser. So it's the newer technology. Fractionated lasers just treat a fraction of the skin, and it's poking thousands of tiny little holes, or microthermal column zones, if you will, to the skin. So you're not treating the entire surface of the skin. So that's what fractionated means. Now, moving on to the second part of this nomenclature, a fractionated resurfacing device. So resurfacing just means it's going to resurface the skin. It's going to treat the top layer of the skin. When you look at the epidermis on cross-section, it's getting the surface level of the skin. Skin on cross-section, when you're talking about tightening devices like Thermage, it's going to get the deeper portions of the skin and spare the more superficial areas. So lasers treat that superficial portion of the skin, which is why it's called fractionated resurfacing. Fractionated, fraction of the skin, resurfacing, because you're smoothing out the surface of the skin. I hope that makes sense. So when you talk about lasers, you have ablative and non-ablative. And the Fraxel Restore device, which I'm talking about in this video today, is a non-ablative laser. Okay, what does that mean? Non-ablative lasers just heat up the skin. So when you're treating fractionated treatment zones in the skin, it just heats up that skin. There's a dissipation of heat and a coagulation process which just increases signal transduction cascades for more collagen synthesis. So in English, what that means is heat is being distributed through these little microthermal treatment zones, and the dissipation of heat is increasing the collagen synthesis process of the fibroblasts, the collagen producing cells in the skin. And ablative lasers, which are non-ablative, ablative lasers, instead of just heating up that skin, it vaporizes that skin and takes it out. So you may have some pinpoint bleeding depending on if you have like a CO2 or an erbium. There's either coagulation or non-coagulation, and it can translate into results that are, pinpoint bleeding and oozing, which is non-ablative lasers don't have that because you're not taking out or removing any skin. You're basically just heating it up with the non-ablative lasers. Ablative lasers vaporize that skin and essentially take it out. So there's more downtime, a little bit more aggressive treatment, and that's okay too. I just like to sometimes recommend more non-ablative laser treatments because the patients will have less downtime and a little bit faster recovery. But that's not to say that ablative lasers aren't good. I love an erbium and I love a CO2. I have a CO2 laser and it works wonders, but there's a little bit more downtime, a little bit more noticeable results. But I feel that Fraxel Restore, also known as Fraxel Dual, is a happy medium because it's still not ablative. It's not an ablative laser, so the downtime is a little bit less and the recovery is a little bit more rapid, and it's not as aggressive, and it's a little bit more aggressive than, say, a clear and brilliant laser, which is also a non-ablative laser, but a lot more superficial, less downtime, no pain, but a little bit less, I hate to say weaker response, but a little bit less aggressive with respect to results. So the fractionated, laser resurfacing, the Fraxel Dual, is a great laser because it does a lot. There's not that much downtime. It's usually 4 to 6 days of a little bit of swelling, a little bit of erythema, also known as redness, and you don't have to do the intense aftercare that sometimes you need with a CO2 or a more ablative laser. Like, you don't have to do vinegar soaks or be on, antimicrobial therapy or medication. You basically just use a rapid post-laser recovery serum, and in about 4 to 6 days, you'll notice a little kind of pinpoint scabs on the face, which we call coffee ground scabbing. It'll kind of look a little dusky and dirty, and as all that sun damage comes to the surface of the skin and gets exfoliated off, you have that downtime. But then 1 week later, you have fresh, beautiful, glowing skin. I actually just did Fraxel on my neck just about a week ago, and I had the desquamation process over the weekend, and now my skin is soft and supple. I'm using my MDR Neck Tight serum, and it's stimulating collagen, and over the next 2 to 6 months, I'll have increased collagen stores in my neck, and probably later on this year, I'll do my face and my chest, but I kind of like to break it up so that I don't scare my patients when I'm in the office seeing and treating patients, and kind of keep that in mind with respect to the downtime. So I touched on this earlier, but because it's also called Fraxel Dual, because it's 2 wavelengths, you have the 1550 nanometer handpiece, and that targets texture. So things like shrinking pore size, stimulating collagen, smoothing out fine lines and wrinkles. It's really good for under the eye wrinkles and crepiness and around the mouth, Stanley Cup lines or smoker's lines. It's great for acne scar revision. It's great for anti-aging. It's also really good for people who have had a lot of sun damage and are predisposed to skin cancer or precancers, which in dermatology refer to as actinic keratoses. So Harvard just did a large study. Actually, Dr. Matt Avram, one of my mentors and a dermatologist who I'm usually at meetings with and at the podium with, he and his colleagues conducted this amazing study for the Fraxel Restore laser and showed that skin cancer and skin precancers were decreased by 50% after fractionated laser resurfacing. So it's kind of a bummer that insurance companies don't cover the cost for Fraxel because it's a much more elegant way to decrease your skin cancer risk, especially those of you who've had precancers that had to get frozen off by your dermatologist or have had Mohs micrographic surgery for skin cancer treatment. It's a lot more elegant and a lot easier on the patient than having to get that liquid nitrogen gun that all of us dermatologists use, or having to do the topical chemotherapy treatment with Carac or Aldera or any of the other topical chemotherapy creams like 5FU and all those other kind of more intense, irritating skin cancer chemoprevention creams. Fraxel laser just once a year will help decrease your skin cancer risk. And it makes sense because it's reversing sun damage. And I always say healthy skin is beautiful skin, because without that sun damage, not only are you not going to have an increased risk of skin cancers, but your skin is going to be rejuvenated. It's going to be dewy and glowy and healthy and without little brown spots and telangiectasias and precancers and actinic keratoses and so forth. So if you look at a child's skin or a young patient's skin, they haven't had a lifetime of environmental exposures. HEV light and blue light from our devices, environmental toxins and pollutants, the ultraviolet light from the sun radiation. And what happens is we accumulate all that trauma and sun damage over time. Our skin looks laxed and we lose our collagen and our elastin, and pores get stretched out, and we get brown spots. That's all signs of sun damage from environmental insults that when you reverse them, or if you're young and you've haven't accumulated them yet, then you get healthy, viable, beautiful skin, because healthy skin is beautiful skin. So if you're not doing a Fraxel once a year for cosmetic reasons, to give your skin a beautiful, healthy glow without the need for makeup, then do it for your skin health to decrease your skin cancer risk and your risk of precancers, also known as actinic keratoses. Now, I just finished my last patient of the day. We just finished clinic, and it's a patient who comes in about every 6 months. She does have a history of skin cancer, and we usually do Fraxel on her face, neck, and chest, and we do it about every 6 months. And we've totally transformed and reversed her skin. She had brown spots. She had an entity called poikiloderma of Savant, when you have kind of that splotchy, ruddy, reddish brown skin with like the brown spots from a lot of sun damage, crepiness on her neck and décolleté, chest creases, and her sun damage on her face was very significant as well. Stretched out pores, an entity called solar elastosis, all the things. And we've been doing Fraxel for the last several years, every 6 months. And not only has she had a decreased incidence of skin cancers, but her skin is beautiful, it's glowing. And now we still have to do Fraxel once a year, because all that damage that you had in your early 20s and even before, the age of 18, can start to manifest in your 50s and 60s. So my patients who do get Fraxel resurfacing and are up on their skincare game and are using their sunscreen and photo protection every day, they'll say, why am I still getting brown spots? I'm wearing sunscreen every day. Those brown spots and those potential precancers or skin cancers are cropping up from decades before. So it's good to just, stay on board and do light laser resurfacing every once in a while if you can, to maintain the healthiest skin of your life. And then your skin will be flawless without the need for makeup. So I'm 47 years old, and I've been doing Fraxel since I was in my early 20s. Now, granted, I didn't do a full face Fraxel. I usually paid attention to the areas where I knew would age fastest, and that was under my eyes and sometimes around my mouth and on my neck. And then once I hit about my mid-30s, I started doing a Fraxel once a year. And I would have to say that my patients who have the most beautiful, impressive skin, especially in their 60s, 70s, and even beyond, it's usually patients who do fractionated laser resurfacing with a Fraxel once a year. So I know that, just being in this industry and knowing what's available, I feel that Fraxel Dual is one of the most impactful lasers over time. Now, we can use it a lot for other things too, not just for smoothing out fine lines and wrinkles, shrinking pore size, eliminating brown spots, evening out hyperpigmentation, and so forth. We can use them for acne scars, and that's the mainstay of therapy for acne scars, especially pitted acne scars, boxcar acne scars, pock-like acne scars, you name it. Sometimes we'll use it in conjunction with a little subcision or a little biostimulatory filler with subcision, but tried and true, usually just 3 Fraxel treatments spaced about 1 month apart will help smooth and improve acne-prone skin and acne scars. So I always tell my patients, if you do have acne, make sure that you have your acne under control before you go in for your acne scarring treatment, because the last thing you want to do is smooth out your acne scars and then have another breakout and then you're chasing your tail. Now, another topic to bring up is skin of color or darker skin tones, beautiful olive skin tones type 3, 4, 5, and 6. Now, Fraxel can be used in these skin types, but you have to proceed with caution. You have to understand the right settings and the pre and post conditioning protocols for the skin. I've had a lot of patients who have been turned away by other doctors saying, no, you're a darker skin type, you're not, a candidate for laser, and that just breaks my heart. That just means, translation, I'm a doctor and I don't know how to appropriately choose your settings. It's not that the patient is not a candidate. The doctor doesn't know how to treat. So it's really important to go to someone who's very well versed with lasers and understands darker skin tones and how to, pre and post condition the skin, the right settings to use, the endpoints to look for. And this comes with years of experience, guys. This comes from years of school and training. I did my dermatology residency at UCLA, which is a very cosmetically laser heavy didactic residency program. And then I went on to pursue a fellowship to further do a procedural dermatology fellowship where I understand and learned lasers from a world-renowned expert. We logged in thousands and thousands of laser cases, mainly focusing on skin of color. So that's my area of expertise. So for darker skin tones, can you do Fraxel? Yes, but you have to be very careful. You have to be very respectful to the skin. I always say we got to respect melanocytes, melanin synthesis, and it can be done, but you have to pre and post condition the skin appropriately. And sometimes I'll choose another laser over another or over Fraxel with a darker skin tone, because if I feel I can achieve the same results without the risk of hyperpigmentation, then I will. If nothing's going to beat, for example, a Fraxel or even an ablative laser like a CO2 or an erbium for a darker skin tone, say there's really severe acne scars, or say it's a burn scar or a post-surgical scar, then we still treat the patient, but you have to know the settings and just really pre and post condition the skin, and usually that will help decrease the risk of post-inflammatory hyperpigmentation. It won't make it a 0% risk, but it will dramatically decrease the risk. And God forbid something happens and you do have some post-inflammatory hyperpigmentation, we have the tools and the armamentarium and knowledge and know-how to reverse that hyperpigmentation side effect. But to answer many of your questions that people are probably going to ask, if I'm a darker skin tone, is Fraxel right for me? It depends on what we're treating, and it depends on the cost-benefit ratio, the pros and cons of using a Fraxel as opposed to a Pico, which has a decreased risk of post-inflammatory hyperpigmentation, or a Clear and Brilliant, which may be a little bit weaker with the treatment level, but it may be safer, safer approximation to your goal, doing more treatments with a weaker laser to decrease the risk of hyperpigmentation. So it all just depends on many, many factors. So I always say it's important to either see me or your trusted laser specialist to see if you're a candidate for Fraxel, regardless of if you're treating acne scars or anti-aging, ailments or things of that nature. So it's always important. But yes, Fraxel can be done in darker skin tones if you go to an expert who understands things and how these lasers work very well. Okay, so can Fraxel be used on other parts of the body? 100% yes, and we get asked this all the time. Even myself will say, can I just Fraxel every body part of mine? The most common areas where we do Fraxel is the face, and like I said before with myself, usually the under eyes and around the mouth are the two areas where we, have the most, we kind of up it a little bit for those areas. You can kind of mess the ratios and the settings, and Fraxel restores very customizable laser, so we'll hit you a little bit harder in those areas, but sometimes people only treat those areas. We can also do neck and chest. Patients oftentimes come in and they'll get their face, neck, and chest treated. What happens is, what is a limiting factor with Fraxel resurfacing is the numbing cream, because you only have a certain amount of numbing cream that you can apply to the skin. And of course, we're a medical office. I'm a board certified dermatologist, so we use the highest percentage of numbing cream. If you go to a Medi-Spa, they're not going to be able to hit you as hard. Well, Medi-Spas probably won't even have a Fraxel because it's too complex of a laser. They usually do more BBL or like lower tier level lasers. No offense, but it just, they may not have the skill or a skill set in order to operate a Fraxel or a Fraxel Dual. But if they do, they usually don't have numbing cream that's strong enough because they're not, a medical practice. They're, a strip mall Medi-Spa or something of that nature. So with the numbing cream strength comes some risk, and you have to manage that risk by only exposing the surface area of the skin to a limited amount of percentage of, either the bupivacaine, tetracaine, lidocaine, whatever the combination of analgesics and anesthetic creams that are applied to the skin. You have to be mindful of that. So some people will say, I want to come in and Fraxel my face, neck, chest, my arms, my abdomen, and my legs. Well, we'd never be able to do that, because not only would that be too much inflammatory cascades going on in the body, you probably would feel like you have the flu with the body surface area treated that large, but we were limited by the amount of numbing cream that we can give you. But we absolutely can do the arms, especially on this area of the arms where there's crepiness, and most people above the knees, on the stomach, all areas. So Fraxel is definitely safe in all areas. I do want to say, when we treat the upper eyelids or really close to the eyelid margin on the lower eyes, we have to put in some intraocular eye shields to protect the globe of the eye. So that sometimes happens, but for most patients who get full face Fraxel, we can get you underneath the eyes, and we just pull that skin over the orbital rim, this bony part of the skull that protects the globe of the eye from the laser photons affecting the eye. So when we get up really close to the lid margin, then we need to put in intraocular eye shields, or if it's of course the upper eyelid, because when you close your eyes and you touch your skin, that skin's very thin and the laser photons can go right through, the upper eyelid skin and affect the globe of the eye and cause, corneal ulceration, corneal abrasion, things that we don't want to get into. So you want to go to someone who knows how to operate, place eye shields in appropriately. And also there's a different laser tip sometimes that we use for the eyes and different settings. But the reason why I really like Fraxel Restore is because it's very customizable. customizable. I never do the same thing on every one patient. And even within one patient, I may change the settings with each treatment. So a lot of dermatologists, especially ones on social media, you'd be surprised, will DM me and say, hey, Dr. Cabell, what are those laser settings that you use? If I have a skin type 3 with acne scars, what settings would you use? And I never give away my settings because it's just something that I've come up with from years of experience and training, and it all depends on the patient's skin type, what we're treating, the thickness of their skin, the color of their skin, and how many treatments may be needed, and the endpoints, how the skin's responding with each pass of the laser. We're always continuously watching, adjusting, and optimizing each treatment that's customized for each individual patient. Okay, many of you are going to ask, does Fraxel hurt? And the answer is, with medical grade numbing cream, it should be very comfortable. Sometimes it could be a little spicy. It depends on your pain threshold. Most people will rate it a 2 out of 10 on the pain scale. But if it's too uncomfortable, what we can do is we can titrate down on the energy, the fluence, the settings, and do more passes. It's kind of like at the gym when you can't really lift heavy, then you make up for it by doing more reps. So if you have a low pain threshold, or if it's too spicy or too hot during the treatment, which most people say that it's very comfortable, and even myself, I've even done Fraxel on myself without numbing just because I'm hardcore like that, but usually when it's in between patients and I don't have time to put on numbing and I'm like, I just want to Fraxel myself. But you can, you can make it very comfortable with the appropriate numbing cream, and if it's still uncomfortable, you can titrate down on the settings and make up for it with the number of passes. And again, that has to do with the endpoints, how the skin's responding, and then you know that you have achieved the energy and the settings to get your desired outcome. So hopefully this answers your questions about Fraxel. If I missed anything, be sure to drop a comment in the comment section below. Be sure to like and subscribe, and thank you guys for your support.